All right. Hi, I'm Dr. Brown. What's your name?
Hey, I'm Sharon.
Hey, Sharon. It's really nice to meet you today. It looks like you're here for your annual checkup. Did you bring anybody with you today?
Oh yeah, I brought my mom. She's out in the waiting room. Is it okay?
Yeah, of course. Before we begin, let me just let you know that anything that you talk about or we talk about today is confidential, okay?
Okay.
All right, so it looks like we should probably go ahead. It looks like we should probably go ahead and talk about your sexual health.
Um, okay.
Okay, so some of the young people that I see in clinic, they're already having sex. What about you? Are you having sex?
I've done some stuff.
Okay. It would really help me if you could be a little more specific. What do you mean by some stuff?
I dated a few guys.
Okay. Uh, Tell me more about these relationships. How many boyfriends do you think you've had?
I've had a couple of boyfriends.
Okay, and when you have sex, are you mostly having vaginal sex? Are you having oral sex?
Yeah, it's mostly vaginal and sometimes it's oral, but I also tried anal once.
Okay. All right. You're using condoms, right?
Uh, yeah, when we first started dating, I used condoms, but once I get comfortable, we stop.
You know, I think it's really important that you use condoms all of the time. If you only use them some of the time, then you can still get an STI, and you certainly can still get pregnant as well.
Okay.
You should probably also be on another form of birth control as well, especially if you're not using condoms all of the time. Have you ever taken birth control or thought about birth control?
Yeah, I used to take it, but I stopped probably about a year ago.
Okay. Well, we should probably get you back on something for birth control, okay?
Okay. Okay, that's fine.
So I wanted to ask you, have you ever heard of pre-exposure prophylaxis?
No, I don't think so.
Yeah, the other name for it is PrEP.
Oh, yeah, is that the pill that gay guys use to prevent them from getting HIV?
Yeah, we usually mostly use it in gay guys, you're right. But now it's recommended that we talk to all of our patients about it, especially those patients who are at risk for HIV.
So, you think I'm at risk for HIV?
Well, I mean, you don't use condoms all of the time, and so anytime someone doesn't have protected sex, they're at risk for HIV. So yeah, I think it would be good to provide you with some information about that. I've got a brochure here. If you'd like to take this home, you can go ahead and read about it, and if you have any questions, just let us know.
Okay, thanks.
Okay, so I guess now I should ask you a few questions about sexually transmitted infections. Have you ever been tested for sexually transmitted infections?
I think so.
Okay, and have you ever been tested for HIV?
I don't think I have.
Okay. Have you ever been told that you have an STI?
Oh, no.
Okay. All right, so based on what you've told me and based upon your sexual behavior, I really think we should go ahead and do STI testing and HIV testing today as well. So I'll tell you what, I'll go ahead and put in those orders for you, okay?
But will my mom see that on the bill?
Yeah, you're right. Your parents could see that information on their bill and that you got STI testing. So I'll tell you what I can do. There is a free clinic or a community clinic that offers free STI and HIV testing, and I could refer you to them if you would rather.
Yes, please, please. Thank you.
Okay, all right. So there are a couple other questions that I like to ask all of my patients, and you don't have to answer anything if you're uncomfortable or you don't want to.
Okay.
So the next question that I have is do you ever have sex for money or drugs or for anything else?
No.
Okay. Do you ever feel like you're coerced to have sex or pressured to have sex when you don't want to?
No. All of my partners ask for consent.
Okay, that's great. I'm really glad to hear that. And, based on the conversation we've had, I think you're doing a lot of good things to prevent yourself from getting sexually transmitted infections. So that's really, really good. Um, Anything else you wanted to talk about?
Feel fine.
Okay. All right. Well, then I think we're good. Thanks for coming in.
Thank you.
Hey, my name's Dr. Brown and my pronouns are he, him. What's your name?
Hey, I'm Sharon.
Hey, Sharon, it's really nice to meet you. And what are your pronouns?
Oh, my pronouns are she, her.
Okay, great. I appreciate you sharing that. It looks like you're here for your annual exam. Did you bring anyone with you today?
Oh, yeah, I bought my mom, but she's out in the waiting room. Is that okay?
Yeah, of course, that's okay. Before we get started, I do want to let you know that everything that we talk about today is confidential, and that means that I'm not going to share anything with anyone unless you give me permission or I feel that there's a concern for your safety or the safety of someone else. Is that okay with you?
Yes, that's fine. Thank you.
All right. Well, why don't we go ahead and get started?
Yes, that's fine. Thank you.
All right. Well, why don't we go ahead and get started with some questions about your sexual health? Sex is a really important part of people's lives, and I ask all of my patients these types of questions. Is that okay with you?
Yes, that's fine.
Great. So a lot of folks around your age are starting to develop relationships with other people. Some aren't, some are. Some are beginning to have sex, others aren't. What about you?
Well, yeah, I've done some of that stuff.
Okay. Tell me a little bit more about what you mean by some of that stuff.
I've dated a few guys.
Okay. And tell me, tell me more about your partners. Are they all male or do you have sex with people of other gender as well?
No, just a few guys.
Okay, great. And some individuals are starting to get intimate. Have you been physically intimate with any of your partners?
Yeah, I've done a few things.
Okay. Can you tell me more about what you mean by that?
Um, so I've had vaginal sex, I've done oral, and I've tried anal once. I didn't really like it.
Okay. I appreciate you sharing that with me. You know, different people think about sex in different ways, and it means a lot of different things to different people. And so thank you for saying that. When we think about sex, we think about any time there's contact between one person's body and another person's body for a sexual reason. So just like you said, vaginal sex, oral sex, anal sex are all different types of sex. In the last 6 months, how many partners or sex partners would you say you've had?
Oh, I've had three. Two of those were my boyfriends, and one was just a friend. We fooled around, but not for that long.
Okay. And when you have sex, tell me about condom use.
Okay, so for the most part, I use condoms when it's a new partner,
Hmm.
but after I've gotten comfortable with them, then we just stop using them.
Okay. Tell me a little bit more about why you use condoms.
I just do not want to get pregnant.
No, that's an important reason to use condoms for sure. You know, have you ever thought of another type of birth control as well? Have you ever used a birth control in the past?
Oh yeah, so I was on the pill once and it was okay, but I started to feel bloated and I could never remember to take them, so I stopped them about a year ago.
Yeah, gotcha. So certainly it's important to take those types of things into consideration, side effects for sure. You know, there are a lot of different types of birth control. I'd be happy to discuss with you different. So I also wanted to ask if you've ever heard of something called PrEP. The other name for it is Truvada, and it's a strategy that people use to prevent themselves from getting HIV.
Yeah, I think I've heard of that pill. Is that the pill that gay guys use to prevent them from catching HIV?
So you're right, it is a medication that's used to prevent HIV in anyone. And it's now recommended that we talk to all of our patients who are sexually active about PrEP, and that includes women.
Okay, so do you think I need it? Like, am I at risk for HIV?
You know, it's a really good question. And anytime someone doesn't use condoms 100% of the time, they may be at risk for HIV. But I think as importantly, taking PrEP gives a person control over their own body and often gives them the peace of mind that they're doing everything possible to prevent themselves from getting HIV. Is it okay if I share some more information with you about PrEP?
Oh, sure, definitely.
I'd like to continue on with our discussion by asking you a few questions about sexually transmitted infections and if you've ever been tested for sexually transmitted infections. You know, we understand that sometimes STIs or sexually transmitted infections can cause a person to have symptoms, but a lot of the time a person can have one and not know because it doesn't cause any symptoms at all, okay? Do you know if you've ever been tested for an STI?
Yes, I think so.
Okay. Do you remember what kind of specimens they took or samples? For example, did they do a mouth swab or a vaginal swab or draw blood?
Oh yeah, they drew blood.
Okay. Have you ever been tested for HIV?
I don't think so.
Okay. Uh, and have you ever been told that you have a sexually transmitted infection?
Oh no.
Okay, very good. Based upon what you've shared with me, I think that the right thing for us to do would be to go ahead and do both STI testing as well as HIV testing. How do you feel about that?
I'm fine with it, but would my mom see that on her bill?
It's a really good question, and certainly you're right that it is possible that if she looked at her bill carefully that she might see something like that. So what we could do instead, there's a community clinic that offers free testing, and what I could do is I could refer you there and give you some information about that clinic so you could have both the STI testing and the HIV testing for free. Would that be okay?
Yes, yes, definitely.
Okay, I'll get you that information before you go.
Okay,
All right?
thank you.
Just a few more questions that I ask all of my patients, and I want to remind you before I ask these questions that you're not obligated to answer anything, and certainly everything that you mention is confidential.
Okay.
You okay with me continuing?
Yes.
Okay. Have you ever had sex for money or for drugs or for anything else?
Oh no.
Okay. Have you ever been put in a situation where you've been pressured to have sex or to do something sexual that you really didn't want to do?
No, no. I make sure all of my partners ask for consent.
That's awesome. I'm really glad that you do that and you are in situations where feel safe and have consent around having sex. Let me expand that for just a second and ask you about how you feel in other situations. Do you feel safe with your boyfriend?
Yes, I feel safe with him, and he's also very supportive.
Okay, that's great. How about at home and at school? Do you feel like you have folks you can talk to and confide in and feel safe with?
Yes, yes. I get along really well with my parents, and I also have an older sister. She's really supportive.
Great, great. You know, keep in mind that this is also a safe place. And if there's anything that you ever wanted to talk about, whether that's related to sex or sexuality or really anything else for that matter, we would be more than open to having that conversation, okay?
Okay, thank you.
Sure. All right, so looks like we've covered most anything, but before we go, what questions do you have or what other things would you like to talk about?
I don't have any questions right now.
Okay.